Did Egyptians really remove the brain through the nose? Or is that just a museum myth about Egyptian mummification? The short answer is yes, transnasal excerebration is real, but it was not universal. And CT scans show a range of methods and outcomes. Ancient textual descriptions describe workmen inserting a metal hook through the nostrils to pull out brain tissue, and flushing the rest with substances, which is a clear narrative of brain removal through the nose. Modern imaging backs the mechanics. CT scans repeatedly show defects in the thin bone at the roof of the nasal cavity, the cribriform plate of the ethmoid, exactly where a tool would enter to reach the cranial cavity. When excerebration happened, radiologists also see an empty skull or resin filling inside the cranial vault, sometimes with damage along the anterior skull base consistent with a transethmoidal path. That is the clean convergence between ancient description and forensic Egyptology. What does a CT radiologist look for in mummies to confirm transnasal excerebration? First, a breach in the cribriform plate or adjacent ethmoid cells, often with smooth margins, suggesting deliberate iatrogenic perforation rather than post-mortem breakage. Second, the absence of desiccated brain mass, or instead a high-density cast where embalming resin was poured into the skull after removal. Third, remodeling or breakage along the anterior skull base that aligns with a path from the nasal cavity upward. In well-preserved cases, the nasal passage shows a widened channel consistent with tools passing repeatedly during the procedure. Together, those signs form a radiological checklist for transnasal excerebration. But not every mummy fits the textbook. CT surveys of royal mummies demonstrate variability. Some individuals show classic excerebation with resin fills. Others retain shrunken, desiccated brain tissue resting at the dependent part of the skull. A few show partial treatment or ambiguous signs. A synthetic review collating dozens of cases confirms that brain treatment varied by period, workshop, status, and intent. Some embalmers clearly prioritized removing brain matter and sealing the cavity. Others left it in place while focusing effort on evisceration and natron drying. That is why the safest statement is that transnasal excerebation is common in certain phases and contexts. Not a rule for all of ancient Egypt embalming. How was the technique thought to work in practice? A chisel or awl created a small opening through the thin ethmoid region just behind the nasal bridge. A hooked or spatulate instrument was inserted to macerate and extract brain tissue, often combined with irrigation to liquefy and drain the remainder out through the nose. Afterwards, embalmers could introduce resins into the cranial cavity to stabilize the head and inhibit decay. Radiology matches this script by showing resin levels that conform to gravity within the skull and by revealing toolpath damage that begins at the anterior skull base rather than the back of the head. What about physical tools and hard artifacts of the process? Occasionally, CT has captured a slender, stick-like object lodged inside a skull, interpreted as an excerebration implement that snapped and remained in place during mummification. Separately, museum collections and iconography document bronze and reed tools. Consistent with probing and scraping through the nasal root, these finds are rare, but they anchor the procedure in tangible equipment rather than description alone. In aggregate, the artifact record complements the imaging and the classical texts. Common misconceptions are easy to fix with evidence. Myth: embalmers always removed the brain. Reality: CT shows many mummies with retained, shrunken brain, and practice varied widely, especially across time and status. Myth: they drilled from the back of the head. Reality: the most consistent radiological pathway is transnasal through the cribriform region. Other routes are exceptional. Myth: they did this because they thought the brain was useless. Reality: ancient belief emphasized the heart, but the choice to remove brain is better explained by practicality. Soft tissue decomposes fastened by workshop tradition, not by a single dogma. So what do CT scan mummies and mummy autopsy studies add to the story? They move the debate from anecdotes to repeatable signs. Bone defects where tools entered, resin casts where embalmers sealed cavities, and patterns of variability that map to real workshops and real bodies. They also show that even standard treatment had many local recipes, which is why variation in Egyptian embalming methods is the rule rather than the exception. For viewers, the takeaway is simple. Did Egyptians remove the brain through the nose? Often, yes, via transnasal excerebration through the ethmoid, with CT evidence to prove it. But the best answer is nuanced. It happened frequently, not always. And modern imaging, not just ancient testimony, tells us when, how, and with what forensic signatures. If this evidence first breakdown clarified the procedure and its limits, stick around. Next, we'll follow CT cases step by step and show how radiologists read tiny fractures, resin densities, and sinus changes to reconstruct the inside of the Egyptian mummification process without unwrapping a single bandage.